If your doctor wants to switch off your ovaries during breast cancer treatment, this video will tell you everything you need to know. Why you have it, how the drugs work, and what the side effects are. I'm Dr. Liz O'Riordan, a breast surgeon with breast cancer and the author of The Complete Guide to Breast Cancer. And I do the research so you don't have to. Make sure you hit the subscribe button so you don't miss next week's video. So who needs ovarian suppression? Well, there are 3 reasons why doctors do it. One is to preserve your fertility during chemotherapy. Another is if you are premenopausal with an early ER-positive breast cancer and a high risk of recurrence. And the third is if you're premenopausal with stage 4 ER-positive breast cancer. What is Zoladex? Well, it's a type of hormone therapy called a luteinizing hormone blocker, and it's also known as goserelin. Luteinizing hormone is produced by the pituitary gland in your brain, and it tells your ovaries to make estrogen. Zoladex blocks the pituitary gland, so luteinizing hormone can't be released. This means that your ovaries stop producing estrogen, and after 2 to 3 weeks you become menopausal, and that is called ovarian suppression. When you stop Zoladex, your ovaries will start working again, and most women get their periods back within 3 to 12 months. However, if you're approaching the age of the natural menopause in your late 40s when your treatment finishes, your ovaries may not start to work again. How does Zoladex preserve your fertility? If you're having chemo for any type of breast cancer, including triple-negative disease, your ovaries can be damaged. The number and quality of your eggs is reduced, and this can affect your ability to get pregnant in the future. It's more likely to happen the closer you are to a natural menopause or the closer you are to your 50s. Zoladex switches off the ovaries so they aren't affected by the chemo drugs, and that means you're more likely to be able to have a baby in the future. However, it can't replace other methods like egg and embryo freezing, and even if your periods do return after treatment, it doesn't necessarily mean that you have preserved your fertility. There's still a chance that you won't be able to get pregnant. What does it do for ER-positive cancers? So if you are premenopausal, your ovaries make estrogen, and you are given tamoxifen, which stops breast cancer cells absorbing it. New trial data has shown that for women under the age of 45, adding ovarian suppression with Zoladex further reduces the risk of recurrence and death up to 15 years in the future. And there's a link to the study in the notes below. Your doctor may also give you Zoladex to make you menopausal so they can treat you with an aromatase inhibitor instead of tamoxifen, because letrozole and anastrozole only work in women who are menopausal, and that's what happened to me when I had a local recurrence on tamoxifen. So how do you take Zoladex? Well, it comes as a very small implant or a pellet in a pre-filled syringe, and it's given as a subcutaneous injection, an injection into the fatty tissue under the skin of your tummy. Some people find the injection uncomfortable, and I'll admit I was nervous about getting my first one. I'd read several blogs that said it could be really painful, and I'd worked myself up into a right state. One woman wrote that she'd asked her GP for some topical local anaesthetic cream to put on first, but my GP said that it wouldn't hurt and I'd be fine. I thought, you've not had it. If you do use the cream, you need to wait for at least half an hour before the area is numb. So it's important to get the cream well in advance of you having the injection, so it's got time to work. The injection is normally given by a nurse at your GP practice. I had to pick it up from my pharmacist and take it to the surgery. Now, I'm not going to lie, it's a big needle. She pinched up the fat from my tummy, and I don't have much, and in it went. It was sharp, and it was sore, and it made my eyes water, but it only lasted a few seconds. It wasn't fun, but it wasn't chemo. And I was a bit sore and a bit bruised for a day or 2, and you can get some bleeding at times. How often do you have it? If you've got primary breast cancer that hasn't spread, you get it every month. The pellet slowly releases the drug into your bloodstream over the following 4 weeks, and that's why your symptoms can change. It may take a couple of weeks for you to feel really menopausal, and then they'll start to fade as the pellet runs out. If you've been taking it for a while with an aromatase inhibitor, your team may give you the injection every 3 months with something called Prostap instead. How long do you have Zoladex for? If you've got early breast cancer that hasn't spread, you normally have it for 5 years. If you have stage 4 breast cancer, you'll have it until it stops working. And if you're having it to preserve fertility, you'll get an injection before chemotherapy starts, then every 4 weeks during chemo, with the last dose after your final chemotherapy treatment. Do you need to use contraception if you're using Zoladex? Yes, you must. This is really, really important. Zoladex can damage a growing baby, and you can still get pregnant whilst you're using Zoladex, even if your periods have become irregular or if they've stopped. So if you are having sex, make sure you use contraception. So what are the side effects of Zoladex? Like all the other hormone blockers, you will get menopausal symptoms such as hot flushes, night sweats, vaginal dryness, mood changes, and a decrease in your libido or sex drive. And although these symptoms may be quite intense in the beginning, they do usually improve over time. Less common side effects include headaches and tingling in the fingers and toes. Some women will report weight gain, tiredness, and feeling sick. And you might also notice some vaginal bleeding caused by the withdrawal of the hormone estrogen in the first couple of weeks. Check out my video on the side effects of tamoxifen here to learn how to cope with those symptoms. If you've got any other questions about ovarian suppression or fertility, let me know in the comments. I'm Dr. Liz O'Riordan, and thanks for watching my channel.